Folks, and good evening. I'm Nico Barton.
And I'm Casey Koviak. Thank you very much for joining us.
Well, we know that isolation and loneliness are silent killers in our nursing homes, and now experts worry the pandemic will only make things worse.
KETK's Isaac Ramirez explains what's being done here in East Texas to combat these mental health issues in tonight's Value Life Report.
We're just over at Sam's Town Casino playing the slot machine. Something he loves to do.
Ronnie is the proud son of Billy Jack Keith, a veteran and former business owner.
That's a picture of Daddy in World War II, and he just said he got a package from home, and somebody took the picture of it. He don't even remember who made the picture.
Before the pandemic, Ronnie would visit his 96-year-old dad several times a week at an assisted living facility in Henderson.
And we'd sit down and talk and visit for an hour or two about whatever he wanted to talk and visit about. And if he needed to get a haircut, I'd load him up and take him out to the barber shop to get a haircut.
When visitor restrictions were put in place, Ronnie says his dad was not only bored, but felt gloomy.
I know he missed me coming by and seeing him, and I know he missed my brother coming by and seeing him, because it was 2 or 3 times a week that one of us was in there.
Even before COVID-19, social isolation was a serious health risk for older Americans, leading to an increased risk of dementia, stroke, heart failure, and depression. Experts say lockdowns have only made it worse.
I've seen people that have been doing well for 10, 15, 20 years with no issues in depression, and all of a sudden with the isolation, what's going to happen in the future, the unknown, it's really causing some increase in anxiety and depression.
Recently, Oceans Healthcare, with behavioral hospital locations in Longview and Lufkin, hosted a roundtable discussion with East Texas nursing facilities, focused on how to best support the mental needs of residents.
The goal of this was to bring the social workers, the administrators, the nurses, the staff, the activity directors, the people that are there with those residents. You know, we wanted to bring them out of the building and be able to discuss, hey, what are you seeing? We were able to let them know that we can come into their facility and provide telehealth, so those residents can get services while still in the facility.
Experts say communication is key to getting our family members the help they need.
I think letting people know that it's okay to ask for help and that help's there, that's huge.
Ronnie is able to visit his dad again.
They notified us and said, we're going to start letting y'all have 30-minute visits out on the porch. Only 2 members of the family at a time. Everybody has to wear a mask, and we did that for a couple of weeks, and then the visits got to be longer.
But he has a message for those with loved ones in these homes.
You need to check on your loved ones. You need to be there for them, because I said about all the times that he was there for me and my brother. Yeah, you need to check on them, do for them, do everything you can for them, and still enjoy the memories.
Isaac Ramirez, KETK News.
Oceans Healthcare offers both inpatient and outpatient services. They also provide individual treatment programs for adults 40 and older.
What a story this is. A long time